will learn about the role and responsibilities of Anganwadi workers. So, Anganwadi workers, it's a very important topic in community health nursing. The first responsibility of Anganwadi worker is to elicit community support and participation in running the program. So, she have to gain the community support and participate in the different programs that are started by the government of India. To weigh each child every month, record the weight graphically on the growth card. Usually use refer card for referring cases of mother children to the subcenter PSC, and maintain child cards for children below 6 years and produce these cards before visiting medical and paramedical personnel. So what she have to do? She have to wait every child every month. Okay, each child every month. And then she have to make that cards and produce these cards before visiting medical and paramedical personnel. Next is to carry out a quick survey of all the families, especially mothers and children in those families in the respective area of work once in a year. So once in a year, she have to do the survey of the families, especially mothers and children. To organize non-formal preschool activities. In the Anganwadi of children, there is group of 3-6 years of age and help in designing and making of toys and play equipments of indigenous origin for use in Anganwadi. So non-formal preschool activities she can organize, okay, and in which age group? 3 to 6 years of age group. So what she can do? Help in designing and making of toys and play equipments of indigenous origin. Next is to organize supplementary nutrition feeding for children 0 to 6 years and expectant and nursing mothers by planning the menu based on locally available food and local recipes. So we have already all have seen that in Anganwadi, so the formal fee mostly the locally available food and local recipes are provided to the children. To provide health and nutrition education, counseling on breastfeeding, infant and young feeding practices to mothers. Anganwadi workers being close to the local community can motivate married women to adopt family planning, birth control measures. So she can give also health education and can do counseling on about family welfare programs. Anganwadi workers shall share the information relating to births that took place during the month with the Panchayat Secretary, Gram Sabha Sevak, ANM, whoever has been notified as registrar, sub-registrar of birth and death in our village. To make home visit for educating parents to enable mothers to plan effective role in child growth and development with special emphasis on newborn child. So next is to maintain files and records. 10th is to assist the PSC staff in the implementation of health component of the program, immunization, health checkup, antenatal and postnatal check. To assist ANM in the administration of iron, folic acid and vitamin A by keeping stock of the two medicine in the center without maintaining stock register, as it would add to her administrative work which would affect her main functions under the scheme. So she have to administrate the iron, folic acid and vitamin A. To share information collected under ICDS scheme with the ANM, however, ANM will not solely rely upon the information obtained from the record of Anganwadi workers. To bring the notice of the supervisor, CDPO, any development in the village which require their attention and intervention, particularly in regard to the work of the coordinating arrangements with different departments. To maintain a liaison with the other institutions, Mahila Mandals, and involve lady school teachers and girls of the primary middle schools in the village which have relevance to her functions. To guide accredited social health activists engaged under National Rural Health Mission in their delivery of healthcare services and maintenance of record under the ICDS scheme. So she can guide to the ASHAs. To assist in implementation of Kishori Shakti Yojana and motivate and educate the adults and girls and their parents and community in general by organizing special awareness programs, campaigns, etc. So she can assist in implementation of Kishori Shakti Yojana. Anganwadi workers would also assist in implementation of nutrition program for adults and girls as per guidelines of the scheme and maintain such as record as prescribed. Anganwadi worker can function as depot holder for RCH kit, contraceptives, and disposable delivery kits. However, actual distribution of delivery kits or administration of drug other than OTC drugs would actually be carried out by the ANM or ASHA as decided by Ministry of Health and Family Welfare. So she will only act as a depot holder, but distribution would be done by Asha or ANM to identify the disability among children during her home visit and refer the case immediately to the nearest PHC or district disability rehabilitation center to support in organizing pulse polio immunization derives to inform the ANM in case of emergency cases like diarrhea, cholera, etc. So she also help in organizing pulse polio immunization. So this was all about the responsibilities of Anganwadi workers. So now what are the roles and responsibilities of Anganwadi helpers? To cook and serve the food to children and marchers, to clean the Anganwadi premises